Hey guys, Dr. Ray Marquez here, your local chiropractor down at Back Pain Relief Center in Myrtle Inlet. I'm here with Chris Ionicone. Chris is a good friend. He is a training partner with me in judo. He's also a partner of one of our senseis in Myrtle Beach BJJ Judo. And he's all beat up. So we were rolling, was it yesterday you heard it? Yesterday, and he was getting scared of me and I don't know what he was doing, but he fell on his shoulder and he's injured it. And he's actually in some pain in all seriousness, and we're having some limited range of motion and he's feeling some pain out in the shoulder. I've known Chris for a long time. I know his body. I know how things work. So what we're going to do, this is going to be a series of live videos. So we're going to show a little muscle work that we may cut out. We'll come back and we're going to show a few different things that we're going to do on him. But he's telling me that he's having pain here and it all feels tight. And if you feel it, man, there's a lot of tension in there. So all I'm simply going to do is just try to loosen this whole joint up to give him some better range of motion. Something that may be a little tender for him because we're putting pressure on some trigger points, but the end result is what we're looking for. All right, Chris, so it may be short motions. I'm going to put some pressure on the shoulder capsule here, and I just want you to come up and down for me 5 times. 1, 2, 3, 4, 5. Good, you okay with that? We're going to go to the front, and I'm going to want you to touch your knee and then come up as best you can. It's going to be a little more painful because I'm pushing on you. Okay, 1, 2, 3, 4, 5. Good. Okay, touch your belly. If you can, touch your back as best you can. 1, 2, 3, 4, 5. Okay. Now we're going to go here to your back pocket as best you can. Okay, 5 times. 1, back as best you can. 2, 3, 4, 5. We didn't have any swelling, any bruising, anything like that in there. I'm going to be here, down, out, back, up. Okay, 5 times. 1, 2, 3, 4. It's just a little more loose, isn't it?
Yeah. That's a lot.
What happens? You fall, and you know, Chris is the most beat up person I know. Number 1. Number 2, he's the best, the most in shape person I know. By far, much better shape than I am. And I think doing all of that keeps everything tight. And when he gets an injury, you know, I want to get this thing moving the best way we can. Okay, we're going to be here, down, and then touch your knee. Okay? That's 1, 2, 3, 4, 5. Good. Okay. We're going to move on to the neck area because even though it's a shoulder problem, the traps tie right in. He's complaining of some tightness up through his neck. We're going to try to loosen that up. Okay, so look all the way down for me. And a big pull. It can come back up. 1, again. 2, 3, 4. A little tender in there, Chris?
Yes.
5. Okay. Turn your head to the left, and then go up and down 5 times. So what I was getting at with the beat up part, 2, 3, 4. He's got a lot of degeneration in his lower cervicals and his upper thoracic. There's a bunch of herniations in there. Manual manipulation by far is not even remotely appropriate for him. If we would go to adjust this, he'd fly off the table, be in a bunch of pain. But all this muscle work is what's going to keep him going. Turn your head this way, up and down 5 times. 1, 2, 3, 4, 5. Good. Next, I'm going to use just a big old massager here just to loosen it a little more. This should be the easiest part of the treatment. We're going to cut up here for a second. I'm going to get my laser all set up. We're going to use some cold laser on the shoulder to try to get it to heal a little quicker. So tune back in here in just a second. Hey guys, we're back with Chris here. So we just did some muscle work on his shoulder. Next, we're going to use a cold laser that we offer here at Back Pain Relief Center in Myrtle Beach. But the point of a cold laser is to shoot the laser through there, sort of like an ultrasound, except we don't have to put the gel all over there. It's supposed to make the cells vibrate and disperse some of the inflammation and get things to heal a little faster. Patient doesn't feel anything, maybe a little bit of heat under the one while we're doing it. We're going to do a couple spots here. One kind of right in the deltoid, which is where he injured it. We're going to do the AC joint, which is very typical. He landed on his side and may have stress that. And then we're going to kind of do this muscle nut up here in his trap. So maybe you can see that when it comes through. It's just a laser shooting down through there. Again, so we're going to laser his deltoid, his AC joint, and then the trigger points in his trap. Okay, so that's the cold laser part. We did some muscle work. This is cold laser. This is going to take us a few minutes, so we're going to cut out the video. It'll be kind of boring to watch, and then we'll cut back in here in just a few minutes on the next thing that we're going to do. All right, we're back here with Chris again. This will be, I guess, the third part. So number one, we did the soft tissue work or the muscle work. We just hit him with the cold laser. Also, I shouldn't say hit him. We applied the cold laser. Then we use some relief assist. You can get this at our office now. It's a topical pain relief, and we put it on his shoulder and on his trap. Let's go face down for me, Chris, now. So part of a shoulder issue is we're going to work this whole area out up here to hopefully improve the mechanics of the entire region. Now again, I've known Chris for a long time, and this part of his upper back and lower neck is really degenerated. A lot of there's some multiple herniations, there's bone spurs, degeneration, all kind of stuff. And if we tried to manually manipulate that, it would cause even more pain. So I do manually adjust a lot of my patients, but I do know when it's not appropriate for them. So we're just going to use an instrument here just to try to vibrate him a little bit, break up some scar tissue to allow for better biomechanical motion. Pretty tight in there, Chris.
Oh, yeah.
We're going to use our massager again just to kind of get like a myofascial release or muscle release to loosen them up. The next thing we're going to do, some electric stim on him. So we use a TENS unit here. We're going to put some on the trap and on his upper arm. So I don't think we need a video of that. So it's going to be some ice and some electric stim. All right, so we'll cut out and I'll show you the last thing we're doing here in just a few minutes. Okay, we're back with Chris, and you can see we threw a TENS unit on his shoulder, on his trap for a few minutes to try to get some inflammation down, to get the pain to ease up a little bit. We also applied an ice pack for about 10 minutes or so. So we're going to pull them up. Get the stim pads off of them. Okay, we're going to bring you on the roller bed, Chris. So we're going to put them on our roller bed next. So come on over here, we're going back. And the roller beds, what they're doing is intersegmental traction. There's a roller that goes up and down through there, and what it does is just, it loosens up each joint and allows for better mobility, which is less pain. Is that a 2 Christian outlier? Okay, so let's just talk about a couple things. So Chris and I were working out yesterday and today. He injured himself. He did the exact right thing. He came in and saw me right away. So he didn't wait a week. He didn't wait a bunch of time to see if it get better. He came and saw me. We're going to do a bunch of therapy, and we're going to get him to feel better quickly. So that'll definitely speed up the recovery process. We'll get him back on the mat. I see a lot of patients that do judo and jiu-jitsu and different kind of sports. And my job is to not keep you out of the sport, but to get you back in there as quickly as possible. So if you participate in one of these sports and you get injured and you're worried about getting back on the mat, I'm the guy to see, and give me a call and we'll talk about it and see if we can't fix you up. Hope you're having a great day, and we'll talk to you soon.